So you've heard this story many times. You go to the eye doctor, you go for your yearly exam, and your eye doctor says, well, you've got nearsightedness or you've got farsightedness. And they prescribe a lens based on the choice you make, which lens is clearer, number one or number two. And you basically have about 5 to 10 seconds to make a decision on which lens is going to be yours. And maybe that day when you went for the exam, you had a fight with your spouse, or maybe one of your children are sick, or maybe you have a dog or a cat who you had to take to the vet, or maybe you're just having a bad day. And so we know that these external environmental things affect our vision, that if we're under stress, if we're, not all there, our vision is going to be blurrier. So we go in and we're in this dark room and we choose lens number two. It's basically a guess. And we get the prescription and we put it on and we go, wow, this doesn't feel right. Something doesn't feel right. And it may be, I'm feeling dizzy, I'm feeling nauseous. This is giving me a headache. And you go back to the doctor and you share the story with him and he says, oh, Jane, don't worry. I did it right. Just get used to it. Get used to this nausea. It'll go away. So like a good person, you go, okay. And you start suppressing your sensations, your feelings, your vision, and you force yourself into this lens. And so then what happens is you notice about 3 minutes later that, well, three minutes later, let's say 6 months later, it is 3 minutes later, you walk out of the office and you go, wow. And what's really interesting is I have people that spend thousands of dollars on their glasses and they bring them to the exam for me, and they got a shopping full of glasses that they've spent thousands and thousands of dollars and they can't wear it. But anyways, let's say you do force yourself into wearing it, and 6 months later, you go back and he says, Doc, I can't see out of these. I'm blurry again. And the doctor is in a great situation because he says, oh, let's make it stronger. And so you get the stronger lens. Maybe now you're in a bifocal because now you're losing not only your distance clarity, but you're now having difficulty seeing the small print, maybe the print on your phone. And now you're in a bifocal and you're using that, you get that, and it's very difficult to maneuver, but you get used to it. And then maybe a year or two later, you go back and the doctor says, well, your eyes have gotten even worse. Now we got to put you in a progressive lens. So you've got all these different gradients of the lens. This is even more disconcerting. And you're on the computer a couple hours a day and you're trying to focus through a small part of the lens that you can actually see clearly in the progressive lens. Another year later, you're turning maybe 50 or 55. The doctor says, oh, you've got the beginnings of cataracts. And we might as well get you in line because there's no question that this cataract is going to ripen 5 to 7 years. And that when it ripens, we're going to have to cut it out. So get ready. So you leave the office and go, wow, I'm programmed now that not only am I in progressive lenses, my eyes keep getting worse every year, but now the doctor says I'm going to need cataract surgery. And they're all different ways the doctors work. Some of them will say, well, let's schedule you for the surgery now and be proactive with it. Others will say, I'm not really seeing much of a cataract, but you're 60 years old. Let's do it anyway. And so you have all these different experiences. I mean, these are the stories I hear from people. And let's say you started to eat more plant-based. Maybe you started to, explore more antioxidants. You're doing maybe some kind of a fasting. You're involved in a qigong practice or a yoga practice. Maybe you're getting into some meditation things. And you go, this eye stuff, when I go get treated for my eyes, it doesn't line up for me with who I am and what I'm expressing. And this is kind of where a lot of people sit, especially between the ages of 50 and 70. This is the classic eye exam experience. Somebody said the eye exam is like a lie detector.
If you like this video, hit the subscribe button and turn on your notifications. Please send your comments to me. I'd love to hear from you.